Assalamu alaikum warahmatullahi wabarakatuh. I Dr. Muhammad Akram, Department of Eastern Medicine, Government College, University, Faisalabad. Concepts of prevention and control. Prevention. The goal of medicines are to promote health, to preserve health, and to restore health when it is impaired, and to minimize suffering and distress. These goals are embodied in the word preventions. Prevention's definitions and concepts. Actions aimed at eradicating, eliminating, or minimizing the impact of disease and disability, or if none of these are feasible, retarding the progress of the disease and disability. The concept of prevention is best defined in the context of level traditionally called primary, secondary, and tertiary preventions. A fourth level called primordial prevention was later added. Determinants of prevention. Successful prevention depends upon a knowledge of causations, dynamics of transmissions, identification of risk factors and risk groups, availability of prophylactic or early detections and treatment of measures, and organization for applying these measures to appropriate persons or groups, and continuous evaluation of and development of procedures applied. Preventable causes of disease being biological factors and behavioral factors, environmental factors, immunological factors, nutritional factors, genetic factors, services, social factors, and spiritual factors. Level of prevention. Stage of disease, level of prevention, type of response. Pre-disease, primary preventions, health promotions and specific protections, latent disease, secondary preventions, pre-symptomatic diagnosis and treatment, symptomatic disease, tertiary prevention, disability limitations for early symptomatic disease, rehabilitation for the symptomatic disease. Level of preventions, primordial preventions, primary preventions, secondary prevention, tertiary preventions. Primordial preventions. Primordial preventions consist of actions and measures that inhibit the emergence of risk factors in the form of environmental, economic, social and behavioral conditions and cultural patterns of living. Primordial preventions, it is the prevention of the emergence or development of risk factors in countries or populations groups in which they have not yet appeared. For example, many adult health problems, obesity and hypertension have their early origin in childhood because this is the time when lifestyles are formed. For example, smoking, eating habit patterns, and physical exercise. Primordial preventions. In primordial prevention, efforts are directed towards discouraging children from adopting harmful lifestyle. The main intervention in primordial prevention is through individuals and mass communication. Primary preventions can be defined as the action taken prior to the onset of disease which removes the possibilities that the disease will ever occur. It signifies intervention in the pre-pathogenesis phase of a disease or health problem. Primary preventions may be accomplished by measures of health promotions and specific protections. Primary preventions, it includes the concept of positive health, a concept that encourages achievements and maintenance of an acceptable level of health that will enable every individual to lead a socially and economically productive life. Primary preventions may be accomplished by measures designed to promote general health and well-being and quality of life of people or by specific protective measures. Primary preventions, health promotions, health educations, environmental modification, nutrition interventions, lifestyle and behavioral changes. Specific preventions, immunizations and seroprophylaxia, chemoprophylaxis, use of specific nutrients or supplementations, protections against occupational hazards, safety of drugs and foods, control of environmental hazards, air pollution. Health promotions is the process of enabling people to increase control over the determinants of health and thereby improve their health. Approaches for primary prevention. WHO has recommended the following approaches for the primary prevention of chronic diseases where the risk factors are established. Populations, mass strategies, high risk strategies. Population strategy is directed at the whole population irrespective of individual risk levels. For example, studies have shown that even a small reductions in the average blood pressures or serum cholesterol of a population would produce a high reduction in the incidence of cardiovascular diseases. The population approach is directed towards socioeconomic, behavioral, and lifestyle changes. High risk strategy. The high risk strategy aims to bring preventive care to individuals at special risk. This requires detections of individuals at high risk by the optimum use of clinical methods. Secondary preventions. We will discuss later on secondary prevention. Thank you very much.